Think about it. Think about it. Think about it.
Good morning, everyone. Today is Monday, July 28th, 2025. We are here this morning for a work session, and our discussion item is progress update on a 2024-2028 strategic plan. I'm Kristen Stevens, Chair of the Board of County Commissioners. With me is my fellow Commissioner John Kafalis, and we expect Commissioner Jody Shattuck McNally to be joining us shortly. We have our county manager here, Lorinda Volker, and we have Josh Fudge with us, our Director of Performance, Budget, and Strategy, to kick things off. We also have a room full of wonderful people, many VIPs. And so if you are coming up to speak, please introduce yourself, but just want to say welcome to everyone, and I will turn things over to Josh.
Thank you, Commissioner. Good morning, everyone. And I just want to echo thanks to all the folks in the room and other members of the goal and sub-objective teams who have done a lot of work this summer, on which we will be reporting today. So this time we'll be going in numerical order, starting with Goal 1, which is resilient, equitable, and engaged community. Then going on to the others, we do have some objectives or sub-objectives that are complete this quarter, so I'm happy to report on that. And then we have one where we may need direction at the very end, depending on how the discussion goes. So starting off, Goal 1, resilient, equitable, and engaged community. The first objective is to communicate with the public. There are two sub-objectives related to this, basically communicating the progress that is made as part of the strategic plan. Michelle Bird is the objective team leader. She's not with us today, but I can report that the team has made some progress on their mile markers campaign story map project. They have onboarded a vendor with a proposed timeline for the Tier 1 stories at the end of this year. They've drafted key messages and developed collateral of Tier 1 stories. Those are basically the objectives that are part of this current strategic plan. And then, as you remember, Michelle described a couple of sessions ago a mile markers badge system that would really label all of the progress that has been made through this strategic plan and prior strategic plans with a badge system on our website and on printed materials and things like that. They have finalized that process to identify those items and are identifying a vendor for printed materials. That is the update on Objective 1. Any questions? All right. Moving on to Objective 2, which is improving accessibility to the county. The first sub-objective was improving engagement through a single platform, enable our community to communicate with the county through a wide variety of means, whether that's mail, telephone, internet, in person, things of that nature. That is a very long-term project that hasn't yet started, but we have made some progress on sub-objective 2B, which is evaluating our legacy systems to ensure compliance with accessibility laws, especially as it relates to online access. They have completed their vendor engagement, and that vendor created a roadmap that will help the county sustain compliance with accessibility. The July 1st deadline envisioned in that law at the state is now active, so we do need to comply with that. The objective team leader, Mackenzie Lau, is here and can answer any questions should you have them.
Thank you, Josh. Commissioner, questions? So the deadline, this is for the ADA compliance with the website. And so the July 1st was the deadline for getting that work done. Was that extended at all, or that was the extension of the deadline?
That was the extension of the deadline.
Okay.
Hi all, I'm Mackenzie Lowe, the ADA coordinator.
Welcome, Mackenzie. Thank you.
Thank you. Yes, so speaking of that law and that extension and meeting that deadline, according to the new rules that came out at the end of May of this year from the governor's office, according to those rules, there's two sections. There's rule compliance number 1, which is that we have an accessibility statement. We've actually had ours up for several years. So we meet that part of the law 100%. So with access to get a hold of me very easily, to get accommodations in place, to do grievances if necessary. They happen. Have communications in place and all of that. It's rule number 2 that is the one that we are not quite there. We're 95% of the way there. And that other that 5% is mainly due to lack of awareness and potential non-compliance. And the reality of this is we can never be 100% compliant all the time. So we're just trying to stay in that upper 90s% because that's reality. So, and that rule number 2 compliance is more of a choose your own adventure, because it depends on the service and what we're providing and the nature of the program. So sometimes it can be full compliance with WCAG, which is the Web Consortium Accessibility Guidelines. It's an international thing. That's what WCAG stands for. Or it can be providing reasonable accommodations because there's no technology that currently exists to actually make whatever it is fully accessible. So.
Please go ahead, Commissioner.
Thank you, Madam Chair. Thanks, Mackenzie. 2 questions come to mind. One is, I seem to recall in these discussions certain kinds of, I don't know if it was PDF documents or others that were very difficult to help achieve compliance. Perhaps you would you speak to that? And my second question, 2 questions, and that is, how have we engaged the public or people that could really, benefit from these types of acts? How have we engaged them? What kind of feedback have we gotten? That sort of thing.
Gotcha. First part I can definitely answer really quickly. Okay. First part, we're talking building plans, for example. They're very difficult to make accessible. And so accommodations for describing, describing in person or even over the phone what it actually looks like with the dimensions is one way to accomplish that. So the second part, engagement with the public, is actually part of our next portion and their feedback on things. I've gotten a fair amount of feedback from groups, but not necessarily from individuals themselves. on like what we can do to make things better, like our video captioning, for example. I've gotten a fair amount of feedback on that one, and our PDFs, and like how to make, especially like services that include like tables and graphs, making those accessible. And I've gotten some feedback on those from the public. But that is also part of phase 2 of making this sustainable. So,
Commissioner, if I would add, this group has really worked hard, not just to comply with the law, but to really make our website accessible and all of our services accessible, however people may choose to achieve them. And so training is going to be a really big component. So when a staff member gets a call about a PDF that may be a map or a building plan, they know exactly what to do. They offer several different alternatives. They exchange ideas about how best to get the information to the individual. And so we think, we typically go above to make sure our services are accessible, and that's no different. Just sheer compliance is kind of not good enough for us. We want to do better.
yes.
Yes, thank you. Thank you, Lorenda. Just one more follow-up. And I appreciate and I agree 100% that we're not just trying to, meet the bottom threshold, the bar. We want to exceed that, as we often do. So I'm grateful for that. I'm wondering, I believe the state law that was put in place regarding ADA accessibility in websites applies to all or most jurisdictions, including municipalities, and therefore, what is the level of cooperation, collaboration that is occurring so that we might learn from each other and not have to reinvent wheels when we don't have to reinvent wheels?
Yeah, there's a lot of that collaboration going on, a ton of it. So we're all trying to find the best way to approach this as a group, not necessarily as individual entities. So it's hard. It's not easy.
Thank you, Mackenzie. Thank you for your work.
Thank you. The other part to this,
Go ahead.
if you don't mind. This is the key recommendations from the consultant that we got, which will probably answer your previous question about engagement with the public. What the consultant, we ended our engagement with them in early May. And the key things that they gave us to make this more sustainable was like that digital accessibility training and implementing it across the board so that we can basically stop adding accessible content. We just want to stop the bleeding. We don't want it to get any worse. And then to work on our procurement and development practices. And this also involves training, collaboration, and just not buying like whatever thing will potentially work, but also trying to make sure that it's accessible for everybody, including our employees. So, because they're part of the community too. Third one was that reasonable accommodation, knowing your customer. This is a big one we've been driving, especially for those departments. Like I said, like building plans are really hard to make accessible, incredibly hard to make accessible. And so finding those alternatives so that people can have equal access to what they need to get the services from us. The other big one is this continued prioritization of PDF documents. And what that really means is what needs to be a PDF and what doesn't need to be a PDF. And if it doesn't, it should probably be a website because it's much more accessible than a PDF. And so it's trying to figure out, what the things that need to be a website and addressing it immediately versus the things that haven't been touched for a while and like archiving. And then the last one is responding appropriately and with a timely manner for these complaints and accommodations. And the last little bit of this, kind of what we've been talking about the whole time. We're now in the full effect of this state law. So grace period is over, has been. So far, we're doing great. The next part is understanding this risk of noncompliance, which a lot of people do understand this pretty good, of that there is a potential risk for noncompliant things and not responding appropriately. So And this collaboration with other entities you asked about earlier, actually, this phrase, normalize and operationalize, we are all owners, was actually a common phrase that I encountered with other ADA coordinators across the state and how we were approaching this. Reasonable accommodation, just going to drive this home. Know your customer, know your audience. So, and then it starts with all of us. It's not just one person. It's not the last one in line. It's everyone who's involved. And then our next steps are actually part of this. We have some resources for employees that are available on the B board. It's digital accessibility. I'm trying to remember what the address is, but it's on the B board. If you type in digital accessibility, it comes up with a bunch of resources that employees can use to make things more accessible. And so we started this as a training portion, like a holding part for this. Our next phase is implementing the training and this sustainability portion of this project. I think I got it all.
Thank you. Any further questions, Commissioner? Okay. When you say understanding the risk of noncompliance, I don't know that I understand the risk of
Okay.
noncompliance. And then with the situation where we're pretty much 95% compliant, but there may be spaces where somebody uploads something and we don't know about it or that kind of situation. I mean, how strict is the law? Do they allow some flexibility or some time to remedy, something that might be wrong?
That's a great question. I can get back to you on that part specifically, but about that flexibility, off the top of my head, I don't remember if there's a timeline to it. I do know the risk for noncompliance is basically a fine for every single little instance. So if we have 200 of those, and I don't remember the exact fine amount, but it's 200 times whatever that fine amount is. And then there's also this, even if they could also still go to the DOJ and fine us that way too. And we'd have round 2 of the DOJ looking into all of our stuff again and with a fine-tooth comb, like they did in 2017, which is how the accessibility program was created in the first place. There's also risk of that again if there was a complaint that went that far. And then we'd have to go through that and then fix the problem in addition to paying the fine.
So this is a state law, but because it deals with Americans, the ADA, the American Act, it would forward up to the DOJ
could.
if there were okay.
Yeah, there's none of the law says that they have to just go to the state. They can go to the feds as well with a complaint.
Interesting. Okay.
So-
And then the sort of reasonable accommodation would be like a building plan that no one's really figured out how to make that
Yeah.
totally accessible. So reasonable accommodation would be somebody could call you and
you
you
could
could,
describe
or type a letter, or, kind of contact you via email or however they wanted to get in touch with you, and you could describe that.
Correct.
Okay. And that is considered okay.
That's considered a
Okay.
reasonable accommodation.
Okay, perfect.
Yes.
All
Key
right.
thing being reasonable.
Well, thank you. This is a
Yeah.
tricky area, and it's, obviously, the fines are significant, and so I appreciate and honestly, everybody on our staff has to be diligent about this, right? And so there's where the education piece comes in. So it's not only outreach to our community, it's outreach to our employees to say, before you put something up, before you buy a piece of software, you need to be really conscious about, how is this, accessible to all
Correct.
folks? Okay.
Correct.
Well, thank you. Thanks.
Yeah.
That's a big job. I appreciate that.
You're very welcome. Thank you.
Mackenzie and Greg Turnbull also came to a department head meeting and presented some of the same information a little more in depth. But they've been having what they call accessibility cafes for the people who do the website work across the county. I'm looking at the agenda, the list. You've been doing this for quite some time. So this is not new for our folks. Still, I imagine we are uploading a photo or something from time to time without the required description. And so we're talking about how do we catch that when it happens before the public sees it, before it creates a barrier to access for the website. So more to come. I think the other complicating factor is right now this isn't a federal law, though it's likely to be at some point in the future soon. So software manufacturers that are national software manufacturers don't always have accessible components of their software. And so we're working on that as well. That's why we don't want folks to just go buy something without running it through the committee to make sure that it is accessible or can be made accessible. So they're doing a lot of good work.
Well, thank you. Thanks for explaining that, Linda, and thank you for your work.
Absolutely. Thank you.
Thank you, Mackenzie. The final objective under Goal 1 is maximizing partner relationships. We do have 2 sub-objectives to report progress on at this time, and so I will turn it over to Sergeant Robert Cook from the Sheriff's Office to walk through the co-responder unit.
Good morning, Commissioners and County Manager, and shout out to our committee who...
You'll need your mic on, sorry.
Oh, good morning, Commissioners and County Manager. Shout out to our committee members who showed up to kind of support what we've been doing on our committee. Want to give you a brief update on the co-responder program and also talk a little bit about our successes and our challenges over the last couple of years. And first of all, our staffing, wanted to give you an idea of what our staffing is. Currently, we have 5 deputy positions, 6 clinicians, 1 corporal and 1 sergeant. That provides 4 teams for Larimer County. And then a 5th team is part of our youth crisis response team, which is our program that is in Thompson School District, where we have a co-responder program in the school district, and 1 deputy and 2 clinicians from Thompson School District will respond to crisis calls within the schools. Our overall mission really is to save lives and provide help, not harm, while responding to crisis calls and calls for service involving mental health issues, substance use issues, or a combination of the 2. In part of our successes, we were able to expand our unit in 2023. We added 1 clinician supervisor, and those are both contract employees with Summit Stone. We added 2 sheriff's deputies to the unit and 1 corporal. And we used a lot of different funding sources for that. We have grants through Summit Stone, which help fund the clinician positions. We were fortunate enough to use and be granted a monetary funding grant from the Regional Opioid Abatement Council, which helped us fund the 2 deputy positions and the corporal position. And then in addition to that, we have worked obviously in collaboration with both Summit Stone, the statewide grants through BHA and Thompson School District. But unfortunately, what I'm reporting today is there is a significant funding shortfall for future outlook, and we'll talk a little bit more about that in a few seconds. Another success that I think is worth noting is that we really try, and really the purpose of co-response is trying to keep low-level offenders out of jail, because many times they're the actual issue when we triage it is that they're suffering mental health issues, they're suffering from substance abuse issues, or a combination of the 2. And our rate of contacts for everyone that we've contacted, only about 2.8% result in a criminal arrest. We also try to divert people from the hospital emergency department rooms. Only about 10% of our subjects contacted were placed on a hold and went to area hospitals instead of Longview. Obviously, our collaboration with Summit Stone Longview has been good in that majority of the people that we encounter that need to be placed on a hold, either alcohol, substance use, or mental health, go to Longview, and that's been a great resource for us. About 52% of our subjects that we contact were placed on an involuntary hold. Many times we try to get people to voluntarily go with us, and that's fairly effective, exercising patience and de-escalation skills. But only 52% of the people that we contact have either gone on an emergency commitment hold or a mental health hold. Another success that I think is noteworthy is that with our small unit, we handle about 68% of all the calls that come in for service for mental health, substance use, or a combination of the two. And that has been as a result of our expansion. We also created, as you are aware of, the Youth Crisis Response Team in 2023 with collaboration initially from Summit Stone, Thompson School District, and the Sheriff's Office. One note, though, and as I mentioned earlier, Thompson School District decided to break away from Summit Stone, and I think part of it was cost-saving measures. There were other issues involved too, so you'd have to probably contact them to get additional details on that. But because they needed to save some money and because of other issues, they decided to hire their own clinicians. So starting this school year, here in a couple weeks, we'll have 2 Thompson School District hired clinicians that'll be working with one of our deputies, and we'll continue that youth crisis response team in Thompson School District. Along with successes, there's always challenges. So we wanted to bring up to your attention a couple challenges that we've had with clinician vacancies. We've had a difficult time filling our clinician vacancies with Summit Stone. One position that we do have has been vacant for over 2 years now, which is difficult. I mean, we were able to get the expansion, and I think that provided more hours of coverage for the unit. But with that one vacancy that's still out there lingering, it's been difficult to try to have that full coverage that we're really looking for. In addition, even though the funding through Larimer County Behavioral Health Services for that extra clinician and the clinician supervisor position that we had has been paid for, we still don't have a Summit Stone supervisor for the LCSO clinicians that work for us under Summit Stone. So even though we've had the program and we did the expansion, that clinician supervisor position hasn't been filled yet either. The other challenge that we're currently kind of trying to deal with, and it's really up to my bosses and our command staff in working with Summit Stone, is more of a philosophical difference about what our clinicians in the field, our co-responders, should look like when they're with us. Currently, they're issued body armor for their protection and their safety, because we do a primary response model where they ride with the deputy the full shift. Sometimes that means they go to calls where it may not be a co-response call. They may go to an emergency call. So we want to make sure that our clinicians are well protected. One of the things that the clinicians asked us to do was to go into a removable vest carrier, such as what I'm wearing today, so that when they're in the office, they can actually take it off and then put it back on when they enter the patrol car and go to calls. Right now, what they wear is under body armor that's concealable, which is pretty hot to wear. I think you can ask or see with some of our deputies that don't wear the outer shell carrier, that it makes it difficult for them to feel comfortable when they're working. The other thing about that external vest carrier is that it's very identifiable as co-responder or clinician. It's marked with both markings so that people know when they're out with the deputy who they are, that they're not just another deputy who's in plain clothes or someone who doesn't belong on the scene. We've had that happen before too, where our clinicians are mistaken as like bystanders or people don't know who they are. So we've really been working with Summit Stone over the last year and a half or so to try to resolve that issue. The clinicians would like to wear it. We think it's important for them to have that. Summit Stone has a different opinion on that. I think you'd have to probably talk to them to find out more about what their opinion is. But so far, we're kind of at a deadlock on that issue. But it's something that we hope to come to a resolution on soon. Future outlook, I think the program is going well. I think it's very popular. There's been a big increase in public awareness about what we do, and so we're seeing and experiencing more times when loved ones of family members who are experiencing mental health or substance use issues are actually calling the sheriff's office and asking for the co-responder to respond because they realize that we have that now. And there's many success stories that I can go into. I know today's not the time for that, but I think overall it's been very successful, and I think it's been a great service to the public for our visitors and our residents in Larimer County. One of the future outlook concerns that we have, though, is funding. In 2023, we applied for and received funding to expand the unit. And for the last 2 years, we've had about $550,000 funding from the ROAC, which has been great. That has been helped us to be able to fund those 2 deputy positions in the corporal almost completely. We've had to backfill a little bit on that, but in this year's funding, 25-26, because we've received grants for the 3rd year in a row now from ROAC, it's been cut down to $284,000. So unfortunately, that only pays for about 60% of what the costs are. We're expecting that the funding for our clinicians through the grants that the state has and through Larimer County Behavioral Health Services will continue. We haven't heard that that's going to change. But we do currently have a shortfall that exists for funding the 3 FTEs that were added during the expansion. And really, although we're not going to go into detail, other than people are definitely more aware that we have a co-responder program, we don't really have an update on Objective 3, Sub-Objective 3E today. Okay.
Thank you. I guess we should have asked if there are questions. Commissioner Cavallo, sorry, Sergeant. Commissioner Cavallo, do you have any questions?
I'll offer one question at this time.
Okay, please, go ahead.
Make sure you may have some good questions. And that is, well, first of all, thank you, Sergeant Cook.
You're very welcome, sir.
I'm wondering, the relationship with the school district is with Thompson, but we have 2 other school districts in Larimer County. How come we're not working with them, like up in Estes and certainly PSD, Poudre School District?
Yes, that's a very good question. That's something that originally, when we proposed this program with Thompson, we did have some meetings and talks with Poudre School District. At that point in time, they told us that they didn't have the resources to fund a co-responder program. I know that there's ongoing talks. I know that Lieutenant Van Hook has talked with their operations supervisor, director about continuing that. And then I also know that the school district has a new security director who used to be a Fort Collins police officer, Jared Sargent. And he's also been in contact with both me and with Joe Vojanski, who's the security director down in Loveland at Thompson, to find out more about it. But I don't know where that's at with Poudre School District. And really what we're trying to do is do one district at a time. So get it started with Thompson and then hopefully move on to the other school districts. But hopefully that answers your question.
Yes, thank you. And I would be interested in perhaps scheduling a ride-along with the co-responder unit.
Absolutely.
So perhaps we could work with Melissa. It's been a while, I think, since I've done that, or I've done
Okay.
it with Fort Collins Police Services.
Okay, we'd be glad to have you. So
Under-
I will work with her to get that set up.
Thank you, sir.
Okay.
I'll hold off for now because I bet you have some fabulous questions, and then if time allows, I may offer another one.
Okay,
I would also be interested in a ride-along
Okay.
too, so maybe you
Yeah.
can work on that for both
can
of us.
get you both scheduled.
What percentage of your calls would you say involve this type of situation, whether it's a mental health situation or a substance abuse kind of situation where you need where you might need a co-responder?
Well, I think we're experiencing a lot more calls where there's a mental health or substance use or a combination of those 2 issues as part of the call. There are quite a few of those types of calls that come in where a co-responder could be utilized. And one of the things that our unit is really good about is if they hear that another patrol unit is on that kind of a call, that patrol deputy will call for the co-responder to come and assist. But as far as percentage, it's hard to say exactly percentage of, I mean, it's a smaller percentage of all the patrol calls that our patrol units respond to. But there has been an increase, and I think part of that increase is due to the fact that the public knows that we have that unit now. And so they're specifically calling for it. And then also just because of the needs in the community. So I think it's similar to what Summit Stone has reported in the past that, as soon as they opened, they were pretty full right away. And I think that's just a indication of the needs that are still yet to be met in our community.
Thank you. So, it looked like the statistic was 68% of the time with those kind of scenarios, you were able to respond with a co-responder unit, is that correct?
Yes, well, 68% of all the total for patrol of mental health, substance use, or a combination of those two issues involved, our co-responder unit handled 68% of those, so patrol didn't have to. So we have coverage in the morning from 7 a.m. until midnight when we're fully staffed with clinicians and deputies. So that's a pretty big chunk of the day. There's still a few calls that come in after that time, or sometimes when we're on a call, we have usually one team. There's a little bit of overlap where we have sometimes two teams for a couple hours in the afternoon, but usually we just have one team working. So if that team is on a call at the time, then patrol would have to handle another call that's happening simultaneously. But for the most part, we're handling the majority of all those calls with the coverage that we have currently.
That's great, I appreciate that.
Absolutely.
With the calls that come in, I mean, there's probably training for patrol that work, maybe some of those later shifts to help kind of identify those situations, maybe how to deal with those. I mean, I'm looking
Yeah.
at the sheriff,
Yes.
but yeah.
We do have, I don't know if you've heard of CIT, Crisis Intervention Team
Oh,
Training.
I have, yeah.
So it's a goal of the sheriff's office to get as many of our employees, both in the jail, our deputies in the jail and in patrol, certified as a CIT officer. And that goes through a whole range of how to communicate, de-escalate, and work with those special populations, especially when they're in crisis.
Yeah, that's great. That's important because everybody wants to try to do their best in those scenarios, but if you don't have the tools to understand how to deal with that, it can be really difficult, I'm sure. So we appreciate the work that you do. And thank you for making us aware of some of the kind of financial situations that are occurring or might occur in the future and maybe some of the challenges that you have around the vests and things like that,
Yes.
which, we don't always know about that kind of stuff. So as best we can, we'll kind of look into those scenarios to see if there's any way that we can be helpful.
Okay, thank you.
You're welcome. Anything else, Commissioner? Please go ahead.
Yeah, thank you. I have two more questions. One I think is easier, the other one is perhaps more complicated. And that is regarding clinician vacancies. It's one vacancy's existed for over 2 years, difficult to fill. Why?
I think there's a couple different reasons. I don't know the direct answer to that, because otherwise we would probably try to make that happen. But I think for one, it's a newer type of job where you have a crisis trained therapist or clinician or licensed social worker that gets out of graduate school with their master's. They become licensed, which is quite a process. There's not a huge number of people that actually want to do work in the field. I think a lot of people are more comfortable doing therapy and doing counseling in an office setting, or even more popular now, I think, is virtual counseling, where they can do it, remotely. So there's already a smaller number of people to choose from. I think that's part of the issue. And I don't know why it's been so difficult with Summit Stone to fill that position for us. I think that's more maybe a question that someone from Summit Stone might be able to answer, Commissioner. I just know it's a small field of available candidates, and I think there's a limited number of people that we're all kind of competing for. And there are other programs out there. There are programs that where agencies hire their own clinicians, like in Longmont, or UC Health provides clinicians too, like for Fort Collins co-responder unit. So a lot of different answers to that, but I think the one I can comment on that I know about would be that I think it's a small number of candidates that really want to do that kind of work.
Thank you. And just a quick comment in response to your answer, sir, and for the listening of our BHS director and others at Summit Stone, and that is, as we look at talent pipeline issues and training folks, I don't know if there's a specific certification or training or incentive to do this type of work, clinical work out in the field. So that's something, School of Social Work and our folks can give some thought to. May I go with my second question? This
Sure.
one is more complicated, and there may not be a an answer. But I'm wondering, in light of the most recent direction from the current administration regarding people who are homeless, and I don't fully understand what that direction is, but it may have an impact on one of your data points, and that is the percentage of people that are involuntarily held. But I'm wondering if your shop has had a chance to review and analyze that to determine what the potential implications might be for law enforcement, for co-responder programs. From my perspective, it seems like, not knowing what this is all about, but it seems like it could create more need, or in other words, put more pressure on you all to provide the services that you do if there's some requirement to, I don't know, get people off the streets.
Yeah, and I don't have
Okay.
a solid answer for that, but I can say that obviously we're watching for those developments too. I think there's been so much happening that I don't think anybody's really completely aware of how that will affect, our future endeavors, and how it will affect the number of people that we have to deal with. I can tell you specifically from our perspective and our statistics that we collect that we are definitely busier, and we're going to more calls. And I think, like I said before, I think part of it's people know about us now. And then I think in the past, people may not have called law enforcement because they didn't know we had this kind of a specialized unit. So I think the issues are there and potentially increasing, like you said, Commissioner. We just don't know the impact of what's going to happen yet, just because the dust doesn't seem to have settled yet. So I'm kind of confused as you are as what the future looks like with that.
I'm happy and honored to be confused alongside of you.
Okay, all right. Thank you, sir.
Thank you, Sergeant.
Thank you, ma'am.
Appreciate that. We're almost done with goal one.
So just for the other sub-objective with this goal to report on, behavioral health is looking to implement a multi-year funding initiative. As you're probably aware, they make impact grants each year, but those grants are for 1 year length. And so they have and will be holding community engagement sessions this month. I have one more to go on the 31st. I attended the one on July 7th, and they're working with a consultant to really, at least at our session, identify those areas that long-term funding can make an impact, such as connecting services, filling those gaps that really make sense for multi-year funding. So they have also updated the website to report on that progress, and that link is here in the presentation, larimer.gov @behavioral health. At about multi-year funding. So I think our behavioral health director is here. Should you have any questions related to this particular sub-objective?
Thank you, Josh. Commissioner Kofalos, questions?
Just a quick comment. Hello, Amy. Just to mention, I don't think it's cited in the slide, but I think recently your shop sent out a survey, and I'm hoping that it's getting a good response. And while I'm not a provider or anything like that, I am allegedly a policymaker, and I actually did take the 15 minutes or so to try to provide some input for that survey.
Thank you.
Yes. Yeah.
So, Amy, we'll have you introduce yourself too. But how are the engagement sessions going, and what's the response to having multi-year funding that you're finding?
Yeah, thank you, and good morning, Commissioners and County Manager. I'm Amy Martonis. I serve as the Director of Behavioral Health Services for the county. We have been engaged in the planning for a multi-year funding process for several months now, and we've contracted with Corona Insights as our vendor who is facilitating the engagement sessions that Josh was speaking about. We've had two. One was last week and one 2 weeks prior. We've had about 75 people participate, and we have over 50 people registered for the session on July 31st, which is a virtual Zoom session. If folks are interested in that or want to learn more about it, please feel welcome to explore the information on our new multi-year funding website. In addition, for folks who can't make one of these preliminary engagement sessions, we do have a community-facing survey that's available for folks to also offer input. And we're looking forward to hearing what the feedback is around prioritizing where we can make the biggest systemic improvements in our system through a multi-year funding effort that'll be really complementary to our annual grant program. So we look forward to returning for a work session in December to provide a menu of options of the recommendations that have come from this work to inform what implementation will look like in 2026.
Thank you, Amy. Well, we look forward to seeing you in December. Hopefully, we'll see you sooner, but we'll look forward to hearing those results in December.
Thank you.
Thank you. All right, on to goal 2.
So goal 2 is quality of life, and the first objective is promoting health and well-being in our community. Related to sub-objectives 1A and 1B, which are really social support and promoting health in vulnerable, and that should say populations. There is a volunteer campaign going on with the Community Health Improvement Plan. One of those portions is called Many Hands Make Light. That's supporting CHIP partner impact organizations with media spotlights, encouraging members to find a connection through volunteering and things of that nature. An example of that is the Meals on Wheels of Loveland, excuse me, and Berthoud partnership. Continuing on with sub-objective 1A, excuse me, UC Health, their board approved the Community Health Needs Assessment in May. This is a federally mandated strategy to focus on access to care, behavioral health, and chronic conditions. The state of, excuse me, Colorado mandated public meeting was held in May with exceptional community attendance and engagement. And then there will be a focus and will continue to be placed upon community partnerships as well as evidence-based classes and connections. Continuing 1A and 1B, the Health District of Northern Larimer County, their 6-month progress report has been published. They have hosted work groups for policy promoting behavioral health through non-clinical methods, data infrastructure, coordination of care, and other items. They are using work groups to develop work plans and track progress to be updated every 6 months. Finally, on sub-objectives 1A and 1B, the community health data collection update is ongoing. The Health District is partnering with the Colorado Health Institute to gather local health data through this year's Colorado Health Access Survey. The data collection for Larimer County concluded back in June. The team is working with the Colorado Health Institute to explore analysis strategies that will support meaningful, actionable insights into the health and needs of communities, including mountain communities like Red Feather Lakes and other rural areas of the county. And then preliminary data from that survey may be available as early as September, with full results expected in late 2025. Any questions on that sub-objective?
Questions, Commissioner Kapalas?
Thinking perhaps you'd like to go.
Okay. Well, I'll start out. First of all, I really like the idea of the volunteerism campaign and encouraging people to find connection through volunteering, because that's a win-win, right? I mean, a person gets to make friends and feel like they're part of the community and have that joy of volunteering and that, that satisfaction. And then, our nonprofits get good volunteers too. So that I just really love that idea. So I'm glad that that's part of our part of this objective. And then just with regard to some of the work that the Health District of Northern Larimer County is doing, and not to add to anyone's plate, and maybe this is sort of an offshoot. It doesn't necessarily have to be part of this plan, but as we contemplate people falling off Medicaid, and people not maybe even getting their nutritional needs met through people also being removed from food assistance in the next couple of years. Hoping that we can work with the Health District of Larimer County to identify gaps So are people, as people lose those kind of basic services that they're used to getting through Medicaid, how do we make sure that our community remains healthy during this time? And so, there again, I don't know that that's something that we log in, but I think that having a conversation with the health district, because they do have access to tax dollars, and sometimes in crisis situations, you have to pivot and make sure that those dollars are available for situations. So we don't want people in our community getting sick or ill or having more disease because they don't have access to healthy foods. And so I feel like this is a looming crisis that would be sort of an all hands on deck kind of situation. And I appreciate their work in behavioral health as well. But I do feel like we could be entering a phase where people are losing their health care. And so are there preventative work that they can do? Are there some dollars that they can set aside for this? And so, I'm certainly happy to have those conversations with the board and with the new ED. But, I have a lot of concerns about people losing their health care and what that means for our community. Probably from a behavioral health care stance as well, but at least we have some dollars for those. We probably don't have the dollars. And then there again, maybe those conversations need to happen with the hospital district as well, because, as people lose health care, they will show up at the emergency room, and that burden will be, somebody will pay for people not having health care. And somebody will see increased people at their doors because of that. And so how as a community do we deal with that? Anyway, enough of that. Commissioner Kafalis.
Thank you. So I would reinforce the comments of the chair regarding future needs and really trying to be as proactive as possible. I think I have two questions. One related to this, I believe, and that is with regard to the survey, the access survey that the health district is currently, has concluded, is now doing the data. Is there a way to access the questions for that survey? Because I know that, and I appreciate you giving a nod to Red Feather Lakes and some of those mountain rural areas in the northwestern part of the unincorporated part of the county. That's a big issue. And we were working with the health district to provide input on questions that might be able to provide insights about what the needs are up in that area. So is there a way to access those questions?
I will have to go back and ask the objective team that question. I'm not sure, but I will check and let you know.
And then my second question, going back to the volunteerism, again reinforcing the value of that, I'm wondering, is anyone encouraging creating a space for intergenerational volunteering? In the past, we've talked about you have maybe a lot of older adults who need to be connected to younger people, or there's a big child care need. What role might older adults play in helping to address some of the child care need? Or I think Commissioner Shattuck McNally her daughter and others have been involved in those intergenerational conversations. I've attended some, and they're very useful. So I'm wondering if anybody's pushing for that.
Same response. I'll have to go back and ask the objective team about that.
That would be
It's a
great.
great idea, and so hopefully they'll encourage that.
Perhaps, yes, please plant a few seeds there and seeing if we can make some progress on that front. Thank you, that's all.
Thank you. Thank you, Josh.
Thank you. I've taken notes on this feedback, and I'll let the objective team know that. So one other sub-objective team, or sub-objective under this objective is the sequential intercept model. The workshop for that was held back on April 29th and 30th. I think there were several dozen participants from around the community who participated in that. The consultant who facilitated that workshop has completed a draft report, and so the team is making comments on that report, and a final report is being developed at this time. Any questions on that item?
Questions? Nope. Okay, we'll look forward to more information on that as it becomes finalized. So it looks like we can move on to Goal 2, Objective 2.
So under Goal 2, the second objective is supporting an equitable economy. There's quite a few updates on this item. First is language access resource. This team is looking at some of the ways that the county has implemented making access to translation and things like that possible. We actually have several resources related to that, and so maybe consolidating that into one could be an option. They're also working on the Power of the P card, which I think you've heard about at prior work sessions, using county purchasing cards, which have great flexibility to really focus on purchasing goods and services here in the community. And they're working on an analysis tool for purchasing and creating a vendor list so that we as county employees, when we use our P card, we can go look and find vendors for those services. Continuing with this, I think at the last quarterly work session, the team talked about drafting a vision statement for an equitable economy. The purpose of that is to really co-create a vision with the community with success metrics and guiding pillars to really, say the county is invested in having an equitable economy. They have presented draft and ideas for this vision statement to a variety of groups, including the Inclusion Advisory Council, the JEDI Coalition, the Equity, Diversity, Inclusion Board, and others. And then there is a draft of the statement that the team has worked up thus far, and you can read it here. I won't read the whole thing. Excuse me, but that's the draft statement. And then just 2B, which is supporting the development of Northern Colorado's care workforce. There is a nursing shortage here in our community, and so this team is working on that through a variety of means. They've also created are working with the Northern Colorado Health Partnership for All. They've had meetings on that with 500 plus attendees, and they are also having conversations with partners to get alignment on really developing this workforce. And so if you have questions about that, our objective team leader, Kelsey Bond from Economic Development, is here to help me out.
Welcome, Kelsey. Any questions for Kelsey on this program? Go ahead, Commissioner Cavallis.
Yeah, thank you. Hi, Kelsey. Regarding the 2B, the care workforce, especially with regard to nursing, I mean, we've had all these events, but how is that translating to actually getting more nurses, whether LPNs, RNs, nurse practitioners, to our area to practice and provide care?
Yeah, thank you, Commissioners. Again, my name is Kelsey Bond with Economic and Workforce Development. So the visual on this slide that you can't see incredibly well actually provides data reflected between 2024 to 2025, highlighting the decrease and or stability of the unique postings as well as the hirings of nurses within. These numbers are reflective of both Larimer and Weld County. We had a nursing shortage program manager for many of the events spotlighted here, really championed that and served regionally. So the data here is reflective off of these events and kind of wraparound services that are both supporting the attraction and retention of healthcare, along with how are we developing the talent pipeline. Specifically, these numbers are healthcare employees. There's obviously a lot to go in care economy, and this objective is beyond healthcare workers. It also includes childcare. It also includes in-home care and some of those direct services. So the data here really does hone in on specific healthcare providers and nurses, and really excited about some of the partnerships with our K-12 and higher ed partners that are really trying to focus in on that talent pipeline and generation.
Thank you, Kelsey. It looks like we're making progress.
Yes, yeah.
Thank you.
Thank you, Commissioner.
Thank you, Kelsey. Any questions? Commissioner Shattuck McNally, and welcome.
Thank you. I apologize. I had to deal with figuring out what's wrong with my foot. So I'm curious about, and again, thank you for doing this well-being conference with the increase in workforce violence and ERs and other areas and things happening, and just kind of after the pandemic, there's just lots of residual workforce conditions that I think are not supporting health. They're all strained out, so I appreciate that. So when we talk about the rural districts and the Nurse Wellbeing Conference, were most of those people from one system or multiple systems? Were they private offices or from a larger system, or were some covering mostly rural clinics? I'm wondering what that makeup looks like.
Yeah.
And do we know what our partners are doing in partnership to kind of also address this internally as well?
Good questions, of which some I'll have to take back to our resident doers in the space of the Nurse Wellbeing Conference. Again, that is a Larimer County and Weld County. Even folks from Wyoming and Southern Colorado started coming up to this event, which has happened 3 years now. And nurses specifically are also able to gain the required credits in order to retain licensure at this event. So it's been a really powerful partnership with the state nursing consortium, as well as some of our large providers such as UC Health and others, to create not only a value add of spaces of belonging and well-being, but also to be able to meet some of those professional development requirements as well. With the rural school district, that is a effort that came out of the health sector partnership. So Northern Colorado 2-county focus, and that was specifically targeting K-12 schools that are in identified rural areas to try to expose access to what would be a health profession in the future. So some of those other questions I'll have to take back. Yeah.
Great, I appreciate it, Kelsey.
Of course.
I do, thank you for sparking my memory about, I think it's person who helped us, Mary, or what was her name from the, that we had, I don't know if she's still around doing that.
Carol Salter.
Carol Salter.
Yes, yep.
Her and a couple of the mentors had received an award for the Thompson School District for some of that work to mentor and to get some youth, and I wanted to remind of everybody that they got, along with the county, getting
Yes.
awarded for the career technical expansion. But I wanted to say that also got some awards and appreciation from the school district. So
Yeah.
I appreciate that. And yeah, I hate to throw you a curveball, but I'm just wondering how, what's also happening in conjunction to help kind of support this and how we could maybe continue the conversation. But
Yep.
thanks for your work. I appreciate it.
Thank you.
Yeah, thank you, Kelsey. I don't think I have any questions. I just appreciate all the work that you and your department is doing in this space. And I love the idea of getting people in middle school, because I think that, kind of starting to plant that seed early is a really important piece. Sort of like sometimes by high school, people are sort of set in what they want to do, or maybe haven't taken classes that can help them prepare for this kind of career. So really kind of getting in there early and planting that seed. And then I think it also goes towards sort of that equitable economy, right? I mean, these are jobs that can lift people out of poverty and that can help people have a very middle-class lifestyle. Some of these jobs pay fairly well, and so I think that kind of making sure that people understand that this is work that they can do and that there is a great need is really important. So thank you very much. All right, Josh, we will move on to Goal 2, Objective 3.
So Objective 3 under Goal 2 is improving housing stability. The first sub-objective to this is inventorying and defining best practices for reentry for justice-involved residents. This sub-objective is waiting on the final results of that SIM mapping consultant report to then identify the gaps that this team can go forth and work on. For 3B, this was retitled at our last work session to participate in the Homeward Alliance strategic plan to address homelessness. The first draft of that strategic plan is nearly finalized and will be presented to the regional elected officials meeting to be held in September. And then finally, on sub-objective 3C, coordinating regionally on land use, This team was delayed a bit by a key staff member here at the county going on a leave of absence for a while, and so that team is picking back up. I think, as I understand it, they've scheduled their first meeting back sometime this month. So that is the update for Objective 3. Our Housing Program Manager, Aaliyah Rodriguez, is here should you have any questions.
Thank you, Josh. Thank you, Leah. Any questions for Leah or Josh on these? Commissioner Cavallis?
So regarding the, I guess we'll see a first draft of the strategic plan at the elected officials gathering in September.
It was already on, sorry. Yeah, I'll introduce myself really quickly. As said, I'm Aaliyah Rodriguez. I'm the Housing Stability Manager here at Larimer County. And to answer your question, Commissioner, yes, I will be sending the finalization of that plan out to all attendees prior to the meeting, so you have time to review before September 29th.
And if I may, just without too much of a spoiler alert,
Sure.
I mean, are you able to share any key takeaways that are providing new insights of how to address a very complex problem?
I don't think we're ready to share the strategies just yet, but I do think, prior you were talking about the most recent executive order and how that impacts our unhoused and how that relates to our police response to unhoused and our services, and all of that is being evaluated. We'll be including a policy crosswalk is what it's called, and we really appreciate the time that the Larimer County Sheriff's Office put into our community engagement to be part of those conversations, and we'll be looking at how policies countywide at municipalities and at the county intersect, and how they can work together to address that together. We'll also be looking at a financial landscape of federal, state, and local funding and how that impacts our response system. The strategy isn't going to be focused on new. It's due to our current state. We're going to be focusing in on what is our homelessness system doing really well right now? How do we augment and maintain that? And that'll be the focus of of the strategies that will be presented.
And just one last question, and you could answer yes or no.
Sure.
And that is, will there be any recommendations regarding the issue of RV campers and vehicles that are sometimes parked in residential areas or commercial areas? Yes, I wonder.
It won't be RVs specifically, but part of that focus of the policy crosswalk will be evaluating parking and camping bans across countywide. Mm-hmm.
Thank you.
Mm-hmm. And really comparing what we have currently.
Thank you, Commissioner. Commissioner Shattuck McNally.
Thank you, Madam Chair. I'm curious, Aaliyah, did you attend the Loveland Housing event last Thursday? It was with the Housing Task Force for Loveland. They had an event.
Oh, their coffee chat?
Yeah, or it was actually, it was in the evening, so I don't know if sure it was a coffee chat. And if so, do you have any feedback or any insights from that conversation? I wasn't able to make it.
Yeah, unfortunately, I wasn't able to make it as well, but Lexi Valenti, our program coordinator within the housing office, did attend, so I can check in with her, and I'm happy to follow up with you. Those events are part of the Loveland Affordable Housing Task Force, so I do attend those meetings, but wasn't able to attend this more community conversation meeting.
And I didn't expect you to, but I thought maybe just perhaps I have some folks who haven't got back to me, but I'd be very curious to hear what was the conversation and how that went, since that seems to be kind of growing as well, it's already a big, huge concern with what has happened the last year and a half, but it seems it would be nice to know what's been said at these other events. So thank you. I would love the information later. Thank you.
Yep, I'll follow up.
Thank you, Leah. I don't have any questions. Just appreciate the work that you're doing regionally, because this is a regional issue, and look forward to the conversations in September with other elected officials. Hopefully we can, as you said, I think a lot of our focus will likely be on sort of how we maintain services in a environment where there's decreased funding. So appreciate the work that you're doing and look forward to those. Look forward to September. Thank you.
Thank you.
All right, Josh, we will move on to Goal 3, Natural and Built Environment, and Objective 1.
All right, we're making good time. We're halfway through the presentation and just slightly over halfway through our time. So Goal 3 is Natural and Built Environment, and the first objective is addressing current and future transportation needs. Under the first sub-objective, identifying a long-term sustainable funding source for capital projects, there will be a work session on this item coming up in just a couple weeks on August 4th to review information for that, and so I won't steal their thunder. Sub-objective 1B, strengthening coordination with partners. Really the first step in this is replacing the road event status system. This has been prioritized by the Information Technology Steering Committee, and so that is in the pipeline to begin work. And then based on that software replacement, there may be then a tool that can be used by regional partners to coordinate construction, especially notifications and things of that nature. This team may consider updating or coming up with alternative language at a future quarterly update for this particular sub-objective. And then finally on 1C, enhancing regional transportation, the Board of County Commissioners received an update from the North Front Range Metropolitan Planning Organization on regional mobility back on May 19th. And so that effort is underway with that group. Any questions with this objective?
Any questions, Smith? I don't think so.
Right. So for Objective 2, developing a sustainable built environment, there are a couple updates here, especially related to sub-objective 2C, which is the Regional Air Quality Council has received funding for mobile food trucks, and 2D, an update from the water team. And so for this particular update, I will turn it over to Heidi Pruis from our Climate Sustainability Office.
Good morning, Commissioners. County Manager Heidi Pruis with the Office of Sustainability and Climate. I'm actually just going to turn this over to Leah Schneider from the Environmental Health Group to give us the first update.
Yes, good morning. And Leah Schneider, Larimer County Health Department, Environmental Health Planner and Air Quality Supervisor. So as you guys recall, one of our, we were trying to coordinate an electrification grant program in that sense. So we had started the last 2 years, we've been doing the electrifying of commercial landscaping for small businesses. And that's been really successful. We just finished another 10 applicants this summer. We've been exploring other opportunities for strategies and funding with other agencies, including the Regional Air Quality Council. And as you guys may recall, we supported them recently with a joint letter of support with Fort Collins as they applied to the Non-Attainment Area Air Pollution Mitigation Enterprise Board, which is created through Colorado Department of Transportation to kind of fund mitigation for air pollution related to transportation. And we just received news 2 weeks ago that the funding was awarded, and it's $1.5 million. And this funding will actually open up Larimer County and Weld counties to several of the programs that RAC has hosted, but they have only been eligible for the 7 southern non-attainment counties. So this is really exciting. We've been trying to push a couple of these that have been eligible if you worked in those counties and things like that, but now we're open and they better be prepared. But the funding starts in 2026, and these programs include Simple Steps, Better Air. This is really just an educational piece, and before we were only had access to digital material. Now we can get printouts, we can have them attend some of our events, things like that to help promote activities that will reduce air quality or improve air quality. Accessible bikes for community. This is one we have not had experience with, but this is going to introduce a bike share programs into our lower income housing communities. So we're going to have to involve a lot of partners as we get close to this. Engines Off is another one. You guys have heard us talk about this. This is the anti-idling efforts at schools. Pooter was attempting to pilot this, but now they'll have full access to resources being in our county. We also will plan to work with Estes Park and Thompson School District. The other one, food truck electrification grants. This is a big one. You can receive up to $20,000 to electrify your mobile units, because currently everyone uses either diesel or gasoline generators. They're noisy, they smell, it just contradicts the sustainability events that we attend and we encourage food vendors to attend. Clean auto repair is a brand new one that will open up to us, and it will require coordination of our repair shops up here. But this will allow people that do not pass their emissions testing to actually go get free repairs on, say, an oxygen center, their catalytic converter, things like that, through our local auto shops. But we just have to find partners that then apply through the rack. So we'll be doing a lot of outreach work through that as well. And the Mow Down Pollution Program is also part of this. It's not on the list here, but that has always been open to Larimer County, and that's just for commercial landscaping operations. But you had to return your old equipment, and then you would get a certain amount back to get electric equipment. But so we'll be working on strategies with Regional Air Quality Council, a lot of our other municipalities. We'll also partner with Weld County to make sure that we're sharing the same strategies and working to promote this for all of our businesses and residents in our areas up here up north.
Thank
Any
you,
questions?
Leah, that's great news.
Yeah.
Questions? Commissioner Shattuck McNally, we'll let her go first this time.
Thank you, Madam Chair. Great work, very exciting, just to be able to have opportunities, more opportunities. And I know that you have been a champion, both of you have been champions, along with Commissioner Stevens, all of us are trying to get what we can do with what little resources to try to address this. So I'm very excited about these opportunities. I'm curious, are all 5 air quality monitoring stations online now?
Yes, they are. And the VOC monitoring has also started as of beginning of July in Timnath and Loveland at the Mahaffey site.
Thank you. I just wanted to confirm that because
Yes.
I had heard, and we can find that online at the health department, correct?
The state health department has those numbers now, and it is a little challenging. We're trying to figure out a way to maybe make that a little easier through our own system with the county so that people can find that data. But that's still in development and discussion.
Great. If you have any tricks on how to track that down as
Yes,
a commissioner
I'd
trying
love
to
to.
understand, I would appreciate it.
Oh,
Thank you.
yeah, I should share the website with you guys. Yes,
Thank you.
of course.
Thank you, Commissioner. Commissioner Cavallis.
Yeah, thank you. Regarding the data that is being provided from the air quality monitoring stations, I appreciate the Commissioner brought that up. Is there an effort to make that data understandable for regular folks?
I would hope so. CSU, Air Pollution Control Division, through the State Health Department, as well as Regional Air Quality Council, are all working on this together. So I would imagine that they're going to make the data more tangible for the general audience and not just those of us geeked out with air quality data.
Will you keep us informed about that?
Of course.
And yeah, it would be nice to have the link so we could maybe, in our spare time, check out the website.
Yeah, and one of the things, so I'll share the website, but I'll also, one of the things, we had to do an intergovernmental agreement with CSU so that they would do the air canister sampling over at our monitoring sites. So part of that deal, we were asking for some reports on what they were finding over the time. So whatever I can, I'll provide to you as well.
Great. And final question, thank you. With regard to the Mow Down program, we kind of start on there was the residential side and there's the commercial side. What is the status of funding for both of those? I mean, can people still take their gas-powered lawnmowers into ACE and get a rebate? Or do we still have money to provide commercial landscapers with the option of, purchasing electric riding lawnmowers, et cetera?
ACE was one of the programs, and I'm trying to double check on the website. So the residential program is closed. Commercial landscape program is still open to all residents, but the residential one was not reopened, I don't think, for this year. But the 2025 program for commercial landscapers is, and that was reopened just because of the brand still. I guess they provided some extra funding just to keep that commercial one going, but unfortunately, the residential program is not available at this time. But maybe that is part of our 2026 funding, and we'll find out more about that as we're planning logistics with RAC.
Great. Thank you very much,
You're
Leah.
welcome.
Thanks, Madam Chair.
Thank you, Leah. Well, I serve on both the Non-Attainment Area Air Pollution Mitigation Enterprise and the Regional Air Quality Council. So Thrilled to, and I actually couldn't vote on our community getting that because so I appreciate my colleagues voting to support that $1.5 million coming to both Weld and Larimer County. This is great news. I love that also lower income communities benefit from these dollars as well. That's an added benefit. And so look forward to seeing what programs we will be able to, how the money will be split up and what programs we'll be able to enact. But I think the education piece, as Commissioner Kavalis was talking about, sort of how do we get people to sort of understand the numbers and what those numbers mean for our health.
Agreed.
I think is a really important piece. We've all seen the sort of warnings, don't go out if you don't have to, and this is a day where pollution, and ground level ozone's really high, and so we've all seen those warnings, but I think that, kind of digging down and that's why I love that we got these dollars, because our community maybe isn't as educated as communities in the Denver metro area because they had those dollars always. And I think about anti-idling and around schools, and I think people would do anything to protect their children, and you have really developing bodies with lungs that are really vulnerable to pollution, and people will sit in line and run their cars while they're waiting to pick up their children. And I think, oh my gosh, I think if most people understood how dangerous that is for young people's health, that they would not do that. And
Correct.
so really kind of making sure that they not only understand the numbers, but, they're again, the very simple ways that we can improve air quality in our communities. So looking forward to that. And I just, in this same vein, I wanted to remind people that there's the Regional Air Quality Commission is having a control strategy blueprint workshop on August 18th from 9:30 to 3:30, which is pretty long time commitment, but it's at the Fort Collins Senior Center. And we'll be working on control strategies to address ground level ozone. So, there are a lot of different sectors that contribute to our ground level ozone program, whether it's industrial and oil and gas, or it's our transportation sector. And so really the Regional Air Quality Commission is tasked with, what kind of limitations to put on those industries to make sure that they're doing their part to not contribute to the ozone problem. So I think for people who want a deeper dive and a more technical dive, I welcome them to join that workshop on August 18th.
Thank you. I appreciate that announcement. They just had the Denver version on the 22nd, so curious to see how that went. But yes, I plan on being at the 18th, so I'm glad you're plugging it.
Yeah, wonderful. And I think there is a hybrid option for people who can't attend in person.
There's a listen in. Unfortunately, I don't think you get to contribute as much.
Oh, okay.
So,
Okay.
yeah.
But at least people can understand what's
Exactly.
going on.
Yeah, and understand why there's concerns. I think you're right, because that education piece as to why we're all worried about this. Because, we always say, highly sensitive population or something. But honestly, this can also impact healthy people, and if they're exposed to a certain amount at a certain time of day for an extended period. So it can impact everyone, and we want people to understand that.
That's right, and there's different ways of tackling this, of how we improve, and it is trickier with our topography and our weather kind of patterns and our sunshine it is trickier for us to sort of improve this statistic, and yet we need to, because it's quite clear that it makes our air unhealthy and that it's not good for lungs, anyone's lungs. So wonderful news. All right, we will move on then to, Goal 3, Objective 2.
So the next update is on sub-objective 2D, which is incentivizing regional water conservation, and I think Heidi will speak to that.
Thank you. So incentivizing regional water conservation does also align with the Climate Smart, Future Ready strategy for our water teams. And as you know, the Water Master Plan was completed, and this team was going to analyze and went through quite actually a lengthy process of identifying those actions that came out of the Water Master Plan, as far as who and what was the action that was going to happen next by whom. County departments and where the county was taking the lead on those actions were divided out, and this team went through the remaining actions and added a couple. And when they got through their prioritization process, what they determined as a group is that while there are water shortage plans from each municipal provider of water, that there isn't a regional collaborative kind of framework by which to go through water drought planning and optimizing like opportunities there for those. So here's who's on the water action team, and they did determine that aligning these strategies was critical. You know, there is a basin-wide, Colorado basin-wide drought plans, then there's a state drought plan, and then we have water shortage plans at the municipal level, but it's this middle ground that's missing. So you can see here that there are water providers engaged, municipalities are engaged, we have some agricultural members who are part of this conversation. If you'll go to the next slide. And what they would like to do is understand better planning for drought and the climate variability that comes along with that. There are a couple of tasks that you can see here on the bullets that get at disaster planning around long-term droughts. You should know that Larimer County has been included in the designated disaster area due to severe drought each year for the last 8 years. And these are often long-term drought, short-term droughts coupled together become long-term droughts. And understanding how those things fit together within our land use planning, within the municipal planning, what are the impacts to the end users. These are things that this team is going to be talking about. This team is being championed by Northern Water, and they're kind of leading the charge and making sure that we have the right players at the table and that we're addressing these issues. So it's a little bit of a change from what the previous water discussions have been, and I wanted to make you aware that this work will be ongoing probably for the next year or two. I don't know if you have any questions.
I'll add to that. The State Department of Local Affairs Office of Emergency Management has also taken on a drought as one of their disaster conditions. And so they're asking communities, what are your plans? If you're a water provider, how are you managing that? And so having this team identify this separately from what the state is working on is really timely. And it's work we're going to need to collaborate on regionally. So Heidi, thank you for pulling the group together.
Sure, thank you.
Thank you, Heidi. Any questions for Heidi? Commissioner Cavallis?
Thank you, Heidi. I think in the last couple of legislative sessions, there was legislation passed that provided some resources and incentives for folks to move from water-intensive landscapes to water-wise landscapes. Are we accessing any of those resources, or is that helping our efforts to get folks to, change their landscaping?
It's a great question. There is a separate water shortage team that is meeting on a monthly basis that is looking at all of those water conservation techniques and how it is that they are going to implement them within their own jurisdictions. So each jurisdiction has a different set of guidance for their citizens within their municipality that gets specifically at that. They are taking advantage of that for certain and trying to coordinate that, but the details of which, as far as Larimer County goes, I'm not clear. I could get back to you on that one.
Yeah, I thought there was money available, and whether or not anyone from Northern Colorado is accessing those funds that could be provided as grants to homeowners or property owners. Thank you.
Yeah, thank you.
Commissioner Shattuck McNally?
Thanks, Madam Chair. Yeah, thank you, Heidi. This is such important work, and I appreciate you kind of keeping the band together and Danelle's work and community development. And I know there's some really important folks at the table. I had a couple of questions. Something that I keep asking about, what is considered adequate water for development? And I'd love to see what that conversation looks like, because I keep asking about it, and the state doesn't have it, we don't have it. It would just be nice to know, as we're looking at growth and things, what is adequate water? Because I think that is something we need to have I don't know, a measuring thing to say, I think, and maybe that would help others have the same one. So, also, I'm wondering about watersheds and in participation from watersheds, because water conservation also has to do with where the water is coming from. And since we have a lot of our watersheds burned still from the last 5 years, and we're not getting the cover with the snowpack, and the water's melting quicker and leaving quicker, I think, I don't know if that's someone's there who maybe might be able to bring some of that, maybe Colorado State University or the Conservation District, someone who might bring some of that perspective. And then also groundwater. I read an article, and I'm trying to think who was it that bought access to one of those big aquifers areas up north part of our county, and I'm wondering what that looks like. Is that a strategy or something we need to look at regionally to how to kind of protect our aquifers and groundwater, so a lot of our residents or wells and other things don't dry up, but also who's kind of putting straws into our county under the ground. So I'm curious about all of that, and certainly I'm really excited to hear about this, and love to be a fly in the room and just listen. I think these would be really powerful conversations. So those are some questions I have, and hoping that we can look at that to maybe brings a little. And I know we're talking about water conservation and sustainable environment, but I think these are all.
They are all interlinked,
So
yes.
thank you.
Thank you for those questions. I'll start with the last one first. Larimer County, we have applied for a groundwater project, groundwater study to be conducted. So stay tuned on acquiring those funds. Similarly, our groundwater team is coordinating with City of Fort Collins team, because they are also working on a groundwater study. So I think your question is a good one and a timely one, and folks are thinking about that. With regard to adding the watershed groups, certainly we can do that within this team, is invite them to join. You should also be aware that through the Climate Smart Future Ready initiative, we do have a land stewardship team, which is heavily populated with members from our watershed coalitions, the Conservation District, and the like, those folks that you mentioned. They also have some questions around water supply, drought, all the impacts that we're discussing here, and they actually do have a member who is going back and forth with the water team to collaborate on these issues and make sure that we have strong voices there. With regard to defining adequate water, I'm putting that down for the team to discuss further, so stay tuned on that one.
Thank you. I know probably you guys have heard me say this a dozen times over the last 2 or 3 years, but I think that's really important for us to be able to figure that out. Also, I just really quick, I wanted to say the town of Wellington and some of these other folks, are those mostly staff? Or there also is a water board up in Wellington that's been dealing with their water supply, water treatment and wastewater, and talking about rates and supply up there. And they have an actual water board with members of the community and their planning commission and stuff. And I'm wondering if some of those folks, since they've been part of those conversations for years, I don't know who's there for town of Wellington, but it might be interesting to get some of those folks' perspective. So just curious about that.
Yeah, thank you. I'll look into that and share that with the group.
Yeah, thank you, Heidi, for doing this work. It seems like every day you're taking on sort of a new aspect of this, so appreciate that. I certainly, having gone through, sort of a drought planning with the city of Fort Collins, understand how important that work is. And it's always been concerning to me that smaller water districts weren't necessarily doing that. And to Commissioner Shattuck McNally's point of what is adequate water, when we're making land use decisions, it would be nice to do that with knowing that there are drought plans in place, and that we do have adequate water for the build outs in certain areas. We just get a sort of a message that yes, we're good and we can provide water to this community, and I think under normal circumstances, that's probably right. And under drought conditions, is that always correct? And so I think kind of getting at this is a really important piece. And I think that's smart that DOLA is involved, because DOLA is definitely sort of leading the charge on housing and density and things like that. And yet, we have to have water to be able to create growth in some of our communities. And maybe some places it just doesn't make sense because of lacking water. So I'm really glad that we're taking this on. yeah, I guess I don't have really any questions, other than looking forward to sort of what some of these groundwater results yield, and how we can, I guess, as a board, are there places where we need to change our land use code to reflect some of this? I mean, I think we've done some of that work, and do we need to do more in the space of, what it looks like to make sure we're not, overusing our water, and that our residents know how to do that?
Of the two tasks that this team identified they wanted to work on from that whole list of maybe 25 possible actions, it was drought and then land use planning, and happening in this particular order for exactly that reason. So yes, thank you for that. And the other thing I will say is that this team recognized that while they all have their water shortage plans, that in 2002, when there was severe drought to the point of the governor declaring such and putting into effect implementation teams, that there were some disconnects and there were some lessons learned there, that now is a good time to follow up on those. So we'll see how that unfolds.
Perfect. Well, thanks for taking this on again. Commissioner
Just
Gonzalez.
thank you. Final comment on my part. I want to make sure that in all of these deliberations, we are considering the nexus between, the importance of water conservation and drought issues and all that, the nexus with housing affordability. That's one of the biggest cost drivers, and how we use water affects the cost of housing.
Thank you for that.
Thank you, Heidi.
All right.
So the final objective under Goal 3 is to develop a sustainable natural environment. If you remember from prior work sessions, this is a much longer term effort where the county is really acting as a convener, and so there will be a much more substantial update, I think, in the January work session as this work is completed. They did have one update that they wanted to share. Apparently there's a really cool tool called the State Forest Service Forest Tracker, and Megan Flanagan from Natural Resources is our objective team leader. She is working with the State Forest Service to develop reporting metrics on using this data. They track it in 10-year increments of treatments to the forest canopy. So you can see the total acres that have been treated over each of the last 10-year cycles. And so there will be an update on that at a future meeting.
Thank you, Josh. Commissioner Shattuck McNally.
Thank you, Josh, and this is, of course, in the Forest Health Council. I think this is the work that we've been doing and working with Colorado Forest Restoration Initiative, CRFI, and the Forest Service, and I know this is a big tool that we have been working with as the Forest Health Council. I think that I paused there a little bit because those are treatments that have been completed, and so it's really looking in the rears, and I know we're kind of working our own tracker tool, which would have acres that are planned or that are in process, and I think that would be nice to have both of those. And also, I think it would be nice to look at the forest. We just approved the 30-year vision for the Colorado Forest Health Council, Thriving Forest 2055. I think that might be nice to kind of align some of those strategies because they are also connected to water and communities and landscapes, and so I think there's some overlap there, and I think that would be great to bring that together. And I think if we're going to talk about years and canopy and things and the pace of implementation, I think we should also be careful about where those are at, because I think the pace of implementation on fairly foothills ground is much different and pace than steep higher elevations. So I think we should make sure we're talking about where they're at and where strategically and what areas of it's in the Black Diamond treatment area or one of these watershed or in our new wildfire defense. So I think it'd be great if we're going forward with that to make sure we're sharing strategically where those are done and where our partners are, especially when it relates to the water plan, since that was identified as a priority area. So I think that would be important to kind of bring that for actually and also for education for the public. So I could talk about this for hours, but I'll stop there. Thank you. And thanks, and please thank Megan and everyone for their work. This is really important stuff. It connects to our water supply. So thank you.
Will do. Thank you. And I'll pass those comments along to her.
Thank you, Commissioner. Anything, Commissioner Cavallis? I don't have anything either. Thank you.
So finally, to goal 4, which is looking more inward at county operations. Objective 1, optimizing county processes and systems. The first item related to artificial intelligence. Greg Turnbull from our Information Technology Department presented the new policy and some of the other issues related to AI in the county to the JEDI Coalition just a few weeks ago. They are working on plans for a countywide Gemini rollout. So Gemini is a artificial intelligence program that can perhaps become kind of the main one to be used by county employees. And they are also continuing to participate in the Colorado Government Association of IT Gen AI group to share knowledge and experience with local governments. 1B, this is one that we're happy to say should be completed. This was initially looking at how resources are allocated for internal support services, but we realized that the budget process is probably better for that. And so this became really looking at how to strengthen customer relationships. We've gone through some focus groups, some surveys of departmental users. And so support services, which is under Mark Pfaffenger's area, and then also PBS, which is performance budget and strategy under my area. We're taking a look at the results of those surveys and developing an action plan to really improve that. So that now we basically consider operationalized, if you will. For sub-objective 1C, this group has finished reviewing and updating the security incident breach investigation and response policy. Very exciting. They will continue to work on those policy areas that need updating and consolidation. And then finally, sub-objective 1D, which is developing community indicators and key performance measures. I'm happy to say our data program manager, Julie Elser, has met with all departments and elected offices throughout the summer to walk through what we're looking at creating here. And they've begun to identify potential key performance, they're usually called indicators or measures. And then the team will go through all of those metrics to find themes and begin crafting real data stories to really make this a robust item. So Julie Elser, our data program manager, is here. Should you have any questions about these items?
Any questions? Commissioner Shattuck McNally.
Thank you, and I really appreciate we're doing this work, and I'm glad we have a policy and we're talking with others. I did get some questions and feedback from Senator Bennett's office and State Representative Matt Rudnell's office and some other folks, state representatives, about the work we're doing and the pace that we're doing and what we're exploring. So I didn't know how we communicate where we're at and what we're doing. They're very interested to see what we're using, what are we anticipating, and you know, what threats or opportunities there are. And so I didn't know how we can communicate with them, because I think they're curious and also looking at legislation or supports of how they can help local governments and others kind of anticipate consequences, but also, like I said, opportunities for this rapidly changing area. So I would be offline, just would be curious how we can maybe bring some of those folks into the conversation, or should we, or can we give them some information about what we're looking at? They're very curious about it. Thank you.
Yeah, we can pass those comments on, I think, to Greg Turnbull and make sure we're communicating that out.
Commissioner Collins, anything? Melinda, did you have something?
I just want to compliment Julie. So she's, in addition to what she's doing in this regard, she's also taken on being the county's representative for a regional data sharing group. So benchmarking against what other jurisdictions are doing as well as internally to ourselves. And that, I think, is a pretty new endeavor. So they're trying to get their feet underneath them. And it's a kind of a big lift for Julie, and I appreciate very much you being part of that group.
Thank you. Thank you for letting us know about that, Lorinda. And yeah, thank you, Julie, for that. I think that that's really important for us to sort of, I mean, not to compete necessarily, but to see, you know, where we stand and maybe where we can do better. I think that's really important. Are departments and elected officials pretty open, do you think, to sort of changing some of their metrics? Because, you know, so sometimes you'll hear in this, well, we haven't changed it yet and we're still working on it. And so are you finding resistance, or are people pretty open to trying to figure out what metrics they should be measuring?
Yeah, thank you. So just again, I'm Julie Elser, Data Program Manager. And yeah, I'm finding that people are very interested and some are even very excited to kind of take this opportunity to revamp their metrics. Some folks here inherited their metrics from their predecessor, so they're excited to maybe come up with their own. And a lot of them are really excited about the opportunity to present their metrics as stories instead of just like standalone charts to actually be able to kind of give a story to the community and explain what they're doing and why it's important and then why they're measuring what they're measuring. So I'm getting a lot of positive feedback from folks.
I'm glad to hear that. I love that storytelling element of that because otherwise that can feel a little bit of dry, like here's my chart and here's my numbers and most of them are pretty understandable. Some of them are less so. And so without the story behind it, it doesn't necessarily resonate with the community and they don't understand the work we're doing as well. So I love that piece and I'm glad you're encouraging that. Thank you very much. Anything else? All right. Thank you, Julie.
Thank you.
And one area that Julie's really helping them with is they can develop internal metrics too. You know, maybe too dry or uninteresting for the public, but really help them with their day-to-day operations. So she's doing great work with that too.
That's great. Thank you.
So objective 2 is collaborating and coordinating with partners and stakeholders. This is another sub-objective that we believe has become operationalized. The county now has two contracts are in place for assistance with grant applications through the budget office. One of those vendors has created a grants roadmap, really laying out what's available for some of the things that we want to accomplish, especially environmentally and with transportation. They hold monthly meetings with updates on opportunities. What's also been really helpful is they provide a good overview of the federal funding challenges and where some of those are at on any given week. And so that's really been educational to have that expertise given to all of us. The finance department is going to start up a grant review group as well to help departments track and stay in compliance with their grant agreements. And so we do believe that this sub-objective has become operationalized and is complete. Any questions there?
Questions on this one? That's good news. Thank you.
Yep. So the second sub-objective under this is co-location with community partners. They are taking an inventory of all of the locations and where services are or can be provided to the communications team, which is run by Michelle Bird, to share out to departments that haven't been on this group. They are creating a map of availability for a future public website and may at some point combine that with the health and well-being dashboard, so it's kind of all in one place. And so developing those tools and perhaps even getting public input in the future are things that group is working on. And then the final sub-objective under here has been complete for some time. That's the updating of the facilities master plan. Any questions on those two sub-objectives?
Any questions on those? I don't think so. Thank you.
All right. And then the final sub-objective of the day, the objective is supporting and developing leadership in various ways. As we've gone through this objective, they initially sort of inventoried the services that we provide, the abilities we have done a gap analysis, and really, if you remember the sub-objective team leader, or the objective team leader for this left county employment, and so we kind of had to figure out where to go next. And as part of that, we've worked with human resources to really identify what pieces are available and where there are gaps. This is the one I mentioned at the very beginning where we may actually want to consider this one completed because it pretty much has been operationalized. We think that we're pretty good to go with this one. And so you can see some of the things that have been done there. And so happy to answer any questions about that one or at least pass them on to our goal leader. But otherwise, you would see this as being completed at future work sessions.
Any questions or comments on this one? Commissioner Shattuck McNally.
This is really exciting to see, and I see there's a lot of, it's over 400 staff completed to date, and I think that's pretty outstanding. I'm curious, when we talk about staff, is this an opportunity for all levels of staff throughout the county, and do we break it out or look at making sure maybe some entry-level folks have a lot of opportunities, and I'm wondering how that broke out. Maybe an offline question later,
Okay.
but I would be very curious about that and
Yeah.
and seeing where we can encourage folks, and I think also hoping all ages and all genders, everybody, just hoping they can see their all potential leadership qualities and within them, and I'm just curious about that. So something offline just to honor our time, but thank you, Josh.
Can do.
I can say briefly, anecdotally, the initial folks were targeted were actual existing supervisors, but since then, it's been expanded to folks wanting to grow their skills and be ready to be supervisors or leaders on their teams. Josh can give you the numbers, but it is both, and including department heads to emerging supervisors.
I appreciate that. Thank you, Lorinda. I think it's great, and I'm glad, it's probably great to do the targeted, but I was really curious about who else has been able to access this, so thank you.
So, Commissioner Cavallos, please go ahead. Are there some programs that are required then for like if you're taking on a supervisory role, do you have to go through like a supervisor training kind of course, or?
It depends on the department or the
Okay.
elected office, and so some are requiring it within the first 6 months or a year to apply and be accepted into one of these programs. They're limited size-wise because we just can't have 100 people go through the program at a time. So we've not made it a requirement, although some departments really lean on it heavily.
Great, because sometimes if you haven't managed people before, that is a tricky business.
Can be tricky.
And I appreciate Commissioner Shattuck McNally's question on, is this available to sort of entry-level folks? So as they're, sort of seeing their place in the county and how they might move up, I think that's really important to make sure people see a pathway. Yeah, so I think this is great. It seems like there's always in a big organization people who don't know about things, and so what does the education piece looks like on some of these programs? Like, and there again, I'm not saying we're doing a bad job, but what does it look like to sort of engage everyone and let them know about these opportunities, even people who may be paying attention less? Maybe are they maybe the one-on-ones with their supervisor, they're getting this information, or what does that look like?
I would say all those ways. So countywide emails, we have our bi-monthly inside information where we promote these kind of things when the application period is open. One-on-one with supervisors who say, hey, this would be a good class for you. I took this class. I think it would help you develop. Lots of different ways to get into these kind of classes. And then, of course, we have our Absorb, our website where we can do all the training that we do online. There are classes beyond what is listed here, a breadth of classes that are offered on that website as well.
Do we do kind of badging and certificate kind of things at all, or have we gone into that?
That's where the gold and silver and bronze have come from. So
Okay.
it's sort of a step up. Basic skills would be bronze. And as you progress and want to learn more, you can go up to the gold, which is ultimately kind of pairing up with a mentor. Not only is it class time with a coach, but it's also pairing up with a leader where you can maybe learn from their skills as well.
Great, thank you. Well, those are all good programs, and I'm glad that we consider that completed, and it's nice to have something checked off. And clearly, like, educating people on all these opportunities is probably the biggest challenge here, so thank you.
So that concludes the updates on the goals and objectives. We have, over the past few weeks, gone through and made sure all of the progress dashboards are up to date. So you can check those out on the county's website, larimer.gov. If you go to the Office of Performance Strategy and Budget, there's a link there for the 2024-28 strategic plan. I can say one part of the accessibility objective was actually making the strategic plan more accessible. It was initially on a PDF document that struggled to make accessible, and so we actually got rid of that PDF and have gone just to pure web-based format so that it's much more accessible. So that's one success right there. The next work session then will be in October to cover the progress that has been made during the third quarter of the year. And with that, that's the end of the presentation.
Thank you, Josh. Any other questions, burning questions that didn't get asked through the presentation? No? Lorinda, any closing words?
I would say this work is other duties is assigned for these teams, and they are putting a lot of work, as you can see, into these efforts. So I just want to say thank you to them. I'm really happy that we were able to incorporate some of the things in the Community Health Improvement Plan and the Climate Smart Action Plan because those were already underway, and they do feed into what we heard at the community meeting as priorities. But still, there's a lot of extra work being done to push these ideas forward, and thank you to all the teams. I know it ebbs and flows over time, but everyone is putting in real serious work. And so Josh, thank you for coordinating it, and for all the team members for the work they're doing.
Yeah, thank you for reminding us about how much extra work this is. This is above and beyond duties, and yet I think everybody can really get excited around this long-term kind of planning that benefits our community and our internal services. And so I am also really grateful, as I know the commissioners are, for the work that's being done here. So thank you all, and keep up the good work, and we look forward to meeting with you in October. And with that, it's 11:52, and we're adjourned. Thank you, everyone.